Welcome to tonight's meeting. My name is Councillor Alex Sanderson. I am the Deputy Leader of Hammersmith and Fulham, and I'm responsible for children and education. I will be taking the chair of the Health and Wellbeing Board this evening as Councillor Kwan is on leave. Before we start, I've got the standard few housekeeping points. So this meeting is being live streamed to the Council's YouTube channel. By participating, you are consenting to being recorded. Please can everybody introduce themselves when they first address the committee, and if the fire alarm sounds, it's not a test. Please leave the meeting in an orderly fashion by the staff fire exit, which is apparently behind me to my right. That way, lovely. Full air steward and stewardess mode there, lovely. And then officers will direct you to the assembly point in Riverside Gardens. Item number 1 is membership changes. So as this is the first meeting of the municipal year, we're asked to note the following membership changes for the 2024 and 2025 municipal year. And that is replacing Councillor Ben Coleman with Councillor Bora Kwan, replacing Philippa Johnson with Caroline Farrar, HCP Managing Director, replacing Linda Jackson and welcoming Catherine Wilmette, Director of Adult Social Care, and to agree the following addition of the membership: Sarah Bright, Director of People's Commissioning, Transformation and Partnerships, the longest title in the world, as a non-voting member. Do we agree to these membership changes? Please do say yes, otherwise good, lovely, thank you very much. Great. Apologies for absence. Apologies for absence have been received from Caroline Farrar and Detective Chief Inspector Mark Staples, but Detective Inspector Shakila Khan is attending in his place. Welcome. And apologies for lateness have been received from Councillor Rowbottom, expected around 7 p.m. And I don't think we've had apologies for lateness from Sue Rooston, but we're hoping that she will join us. Marvellous. Declarations of interest. Do any members of the board have any declarations of interest that they would like to state? Was that a declaration of interest or a... Fine, good, lovely. Minutes and actions. Do members agree the minutes of the meeting held on the 12th of March as an accurate record? Agreed. Marvellous, lovely. Great, well that takes us on to the Health and Wellbeing Strategy 2024-2029. And Dr. Nicola Lang, can I hand over to you, please? Thank you.
Thank you, Councillor Sanderson. I'm Nikki Lang, I'm the Director of Public Health. So presenting to you as the board, the Health and Wellbeing Strategy. It's a statutory duty of the Director of Public Health to produce a Health and Wellbeing Strategy. You can see that it covers the areas that our residents felt were priorities to them, and submitting it to you as the board for approval. We've had extensive community engagement, thanks to SOBUS and other community organizations for their engagement with the creation of the strategy. And we've outlined, the priorities that the residents said. Thank you so much.
Thank you very much. This has been extensively co-designed and co-produced. Do you want to talk us through just some of that, what that co-productions look like of designing the strategy?
Absolutely. So we used snowball methods and also oversampled our residents who came from the poorest neighborhoods. We also, in particular, did oversampling of particular groups like children in care and also parents active. We oversampled new immigrant communities. We stationed ourselves in Shepherd's Bush and White City and heard what people were telling us, and also worked in particular with Muslim community groups and seldom heard other of our residents who wouldn't normally have a voice. We were also fortunate enough to work with an academic who is fluent in 5 languages. So she was able to do some of her work in Somali, Portuguese, English, and other languages. So we really wanted to hear from people what they were saying. It was interesting work, and we did hear from people who wanted their residents in the borough to actually be under the radar. And we also oversampled folks who live in our homeless hostels. Some people felt that it was a bit scary to talk and do a focus group. So we walked alongside people while they were doing things like planting and gardening, so that they didn't have to have face-to-face contact, which some of our residents find a bit frightening. So it took a long time, but I feel that at least we got their words down, and hopefully we'll help them create a borough that they enjoy living in.
Perfect. It sounds like a really beautifully thought through and considered piece of work. So it was really wonderful reading it. Thank you. Does anyone have any questions on this lovely report. Yes, absolutely. Councillor Perez.
Thank you very much. Thank you for the very detailed report, and thank you for summarizing what that process entailed in terms of that co-production. So thinking about that co-production again, I know the different activities that were carried out and accessible to community languages. Are you satisfied that you managed to speak to all the residents that or the representatives of the various communities that we want to speak to, or are there particular communities that we feel like we would like to engage a lot more, maybe from groups from the characteristics, for example?
I think that's interesting. I think we engage all the time. So for some of our LGBTQ+, we commission smaller organizations like NAS and other immigrant groups who work with LGBTQ communities. The phase that we're at now for you, or those of you who are involved in immunizations, is we have a monthly jiu-jitsu vaccine training, again, majoring heavily on seldom heard communities. So we've had mothers from Muslim and other church and faith groups and mosques come so that they're able to have empowering conversations with their peers about immunizations. So we've almost taken the approach here, and we're continuing it in our immunization discussions, and we are learning interesting things about why people are not taking up vaccines. So this was probably the start, and then we'll continue. It's also almost been the seed for growth. So I don't know if Sue is here from the, yeah. So we were able to, thanks to the NHS Inequalities funding, we successfully secured £30,000 for Muslim community groups in the borough. That will be for those groups to have conversations around cancer screening and immunizations. So that NHS funding has been super positive. And also as a result of hearing from certain children's groups, we also secured £10,000 for gym membership for children in care. So it's been little seeds that dropped into the soil and have grown a little bit. So that's positive.
As a follow-up question, well, I looked at the different priority areas. When it comes to children and well-being, are there any concerns around the challenges that come with technology, with all this IT, all the platforms? I've seen a lot of campaigns recently at national level from parents of children that have sadly been affected terribly by social media. And I'm just curious to find out if this is something that fits into the wider strategy and is being explored from a strategic point of view.
Definitely, I'll start and then maybe pass on to Jackie. So we work very closely with children's colleagues, in particular, Peter Haylock, the Director of Education and SEND. We're working with him on a piece now about school avoidance, school attendance, and mental health issues in children. While we have high levels of suicide in adults, we feel that we have high levels of mental health problems, not us especially as a borough, but the whole country. So I think technology will feed into that. But yeah, that work is still in the learning phase. I can't say that I have the answers to that, but I think mental health in children, certainly post-pandemic, post-children not going to school, is certainly an unfortunate legacy of COVID. I don't know if, Jackie, you want to?
I don't want to add anything particularly, except to say one of the advantages of being a people's department now is exactly that we can start to have that enhanced conversations and understanding what's happening in schools. We are working very hard with our schools team, our school improvement team and our schools to drive up attendance. And of course, it's driving up attendance is about the quality of the interactions within the schools. And we have 100% of good and outstanding schools, and we're very confident in our schools leadership. They are experiencing challenges in, as you talked about, resistance to school and aversion, but we have got very clear strategies in place. The technology continues to be something I think we're at the start of exploring, but I think it's really good to hear that the public health are picking that up. And one of the big changes in this document is that we have both the lead member for children in education and adults shared ownership of the document. And I think that's very much marks a step in the right direction. Thank you.
Thank you. And just to thank you, I'm just going to add to that. I think it's something that we are increasingly aware of in schools. Fulham boys have recently banned smartphones in their schools, which is an interesting move, and let's see the efficacy of that, because I think it's a really interesting model. But it's, as has already been said, one of our really big concerns about children's wellbeing is about them being in school in the first place. So there's a stat from the Children's Commission, which is something like 1.8 million children miss a day of school a fortnight in the UK, which is a staggering number. So we can't check in on our young people unless we know they're in school and how they're doing. So that's something that we're very focused on at the moment in children's. And personally, I'm delighted that the wellbeing strategy is going to be both children's and adults coming under the people's remit. There's, again, not to reel off all the stats, but I think the Anna Freud Centre said something like 50% of people who go on to have ill mental health show signs in later life, show signs by 14, 75% by age 24. So it's really, really important to be focusing on young people's mental health and wellbeing. Thank you. Sue.
Hi, Sue Spiller, Chief Executive of SOBUS, which is the infrastructure organisation for the voluntary sector. Love this piece of work. I think it's plain English and enough detail that makes sense to people. You mentioned in your engagement kind of walking alongside people to kind of get their feedback. One of the challenges we know local groups come across is getting information to their residents that's accurate, updated, accessible, available in different languages. And we know there's often a push to make everything available online, but that doesn't always work for all residents, no matter what language they might speak. I just wondered what thought you've given to how that sort of communication strategy can make sure we're reaching the people who are potentially the ones who need the information the most, but aren't finding it very easy to get hold of.
I think that's a really interesting point. In COVID, when I first started doing listening exercises with, say, Somali mums, what they told me is they like WhatsApp. So they like WhatsApp in Arabic, Somali, and English, but the previous methods that I would have thought they liked, they said are outmoded. Don't contact me unless it's WhatsApp. We're also trying new things now. So we recently released a measles, mumps, rubella video, again, with a local dental hygienist speaking those 3 languages. And then we WhatsApp that and shared it with all our imams. So people from seldom heard, underserved groups often want to hear information in ways we are too clunky to understand. So we just do what they tell us now.
Those WhatsApp messages, is there somewhere, so if I was, that's fantastic, that's brilliant, but is there somewhere where people can go and find those videos in a centralized place?
Yes, they're on the council website, and we had 1,000 hits for the MMR video, but we're trying new things. So we're thinking about Instagram now. We've always done targeted work on Facebook, but I rely on my expert comms colleagues to tell me, and also what the communities tell us ourselves. So if they say they would like it in a certain way, then we have council colleagues who will send the video or the WhatsApp. And actually going back to the Jitsu vaccine training, it's very grassroots, so it feels very slow, but we feel as if we're turning the tide, because we can have all the television national adverts, but if we haven't convinced people, it's pointless. So we're taking a very slow approach because things that I've tried here before just haven't worked.
Sorry, I know the Building Trust Initiative did a lot of work in trying to reach people in the community, and I think it is paying off. I think you're right, but that sort of building trust does take time.
Takes time.
So yeah, not going to happen overnight, but that's brilliant work. Well done.
Thank you, Sue.
Thank you. Any other questions? Do you want to do a very quick what the next steps are for the wellbeing strategy? Thank you.
Thanks, Councillor Sampson. The next step will be publication, and then the work continues for all our priority areas there around housing, the environment. This work is continuing, but at least we have a framework and a route that we can base all our other activities on, and in particular for VCS groups to look at as well.
And apologies, I realized I didn't introduce myself as you asked us to. So Councillor Natalia Perez, Chair of Health, Adult Social Care Police Accountability Committee. So you've explained what the next steps are. So in terms of reviewing these priorities, what's the timeline as well? Is there like an annual review of these priorities and actions? And I mean, if there are sort of emerging needs as well, can this be incorporated as part of this strategy? I know it is 2024 to 2029. So how do we make sure that we are achieving what we want to achieve? And also, if there are emerging needs, emerging situations, how do we respond to that as well as part of that process? Thank you.
Thanks, Councillor Paris. So there'll be an action plan, and yes, we would love to come back, for example, yearly, depending on what Chair advises, to the Health and Wellbeing Board to report on our progress. Emerging, because the strategy has taken so long, absolutely. Anything emerging that colleagues, residents feel is a real issue in our borough, we would be able to slot that in. We certainly have emerging issues in the borough that, you know, that we want to reflect, like mental health in children, that's emerged since COVID.
Lovely. Thank you very much. And thank you for this lovely piece of work. Thank you. Is that an agreed report or is that fine to note?
Yeah, it's still
Okay, is the lovely report approved? Great. We can have a nice enthusiastic approved. That would be lovely. Is this approved? Absolute silence in response. Good. I'm going to say that is approved. Thank you. Okay, Catherine, social care position statement and CQC update verbal. So over to you.
Thank you, Chair. So this is just a brief summary of some of the changes we've had in adult social care over the past few months, and a brief outline of our CQC inspection process, which we're about to embark on. So I think members of the board will be aware that the council has reorganised so that, and Jackie referenced this earlier, adult social care is now part of the people department, which includes children's and public health. And we've done a lot of work over the last few months to make sure that we're really capitalising on the synergies between in bringing those three departments together. So we've developed some shared governance. We've got much closer working between children's, adults in key areas, particularly around SEND and young people transitioning to adults. We've developed some really good pathways and some joint working there. And we are, I think it's fair to say, working together as a unified leadership team, and that's starting to reap rewards in terms of us being able to join up different initiatives across children's and health, develop relationships that are holistic. So the health and wellbeing strategy, although that isn't a result of the join up, is a reflection of that. It's looking at a whole person, not just an adult and not just a child. So that's been working very well. One of the experiences we've had is that we've had some turnover of staff in adult social care. So you'll know the previous director left or retired, and there's been several other changes in personnel, inevitably, which happens over time. That's settled down now, and we're becoming much more stable in terms of our leadership team, and staff are much clearer around who the senior leadership team is, because there was a little bit of turnover there. The other, I guess, key agenda for us in adult social care is CQC inspection. So again, some people may be aware, adult social care was subject to an inspection regime for many years, and that stopped in around 2010. It's now restarted. It looks different from how it was before. Very new process. It started properly last December, so it's not been running for very long. But CQC have started a process of inspecting every local authority adult social care department, primarily looking at how well we're delivering on our Care Act responsibilities. There's two parts to the inspection process. It's quite different from Ofsted. So the first part is where they make contact with us and they ask for various bits of information from us. They ask for a self-assessment and then some evidence to support our self-assessment. So we were contacted around that back in May, and we provided a self-assessment. We provided the evidence that was asked of us. The second part of the process is a site visit, which can happen up to 6 months after we've submitted the self-assessment and the evidence. We've now been notified of our site visit, which will be the week of the 21st of October. So I'm sure many people will be aware of that. So we're busy preparing for that at the moment. Part of that process is CQC meeting staff. They're really interested in talking to frontline staff, and they're really interested in talking to residents and residents' experience of adult social care and contact with adult social care, and the information and advice and guidance that's available to them. Excuse me. They're particularly interested also in talking to carers, to family carers, unpaid carers, to talk about their experiences. They'll also be contacting our partners. So this may be one of those. NHS partners, all of our voluntary sector partners, some of whom have already been contacted by CQC. So it's quite a comprehensive process, at the end of which CQC will grade us in the same way that Ofsted do. So exactly the same ratings: inadequate, requires improvement, good, or outstanding. CQC will make a judgment about that, and then we kind of move on from wherever that leaves us. I think it's worth mentioning that the CQC process is still very new and it's evolving as it goes. So I think every local authority that's been inspected has had a slightly different experience because they're just changing things as they go. It does make it a little bit harder to prepare because we don't have the years of experience with, for example, Ofsted, where you can have a sense around what Ofsted will be interested in, how Ofsted will approach a particular issue. We don't have any of that. So it's kind of a learning process for all of us, for CQC as well as for us. But we're working very hard to make sure we have everything in place for CQC, and making sure staff are fully prepared and that partners know what the process is as well. So I think that's quite a lot of work involved in that, because CQC are asking for different bits of information, which we're able to provide, but obviously takes a little bit of time to pull together. Staff are, I think, reasonably confident now around the CQC process, but it will be new, very new for a lot of staff as well. So we're trying to just bust some myths around that and what that will mean for individuals. And I think that's probably it. That's all I can say at the moment. So if anyone has any questions, happy to answer.
Thank you very much. So it's going to be a very busy few months preparing before everyone drops down with exhaustion in November. Any questions in CQC? Go to Nadia first and then Sue. And if we could introduce ourselves, as Councillor Perez rightly pointed out, I'd missed before we start, that'd be lovely. Thank you.
Thank you very much. Although I represent Healthwatch this evening as chair of the local committee, I have an affiliation with Carers Network, which, as you know, is commissioned to provide carer services in the borough. And I wondered, we have been very, very busy, I have to say, at Carers Network, providing necessary sort of intervention and information and detail where required by borough with regards to their CQC inspection. And I wondered whether, I mean, you mentioned involvement with partners. I wondered whether you have a say or a choice in the partners that you want to the CQC to speak to, or whether they're the ones that make a decision. And also, you mentioned, obviously, it's very new for a number of staff because we haven't had such an inspection since 2010. I wanted to ask, do you feel, I mean, nobody has a crystal ball, and I know the pressures involved, and I know everybody's very right. It's going to be extremely busy time until October and beyond as well. But I wondered, how confident do you feel in the findings? I know obviously this council has had tremendous achievements in so many areas of work, and we've had an excellent dementia strategy. I know a lot of work has gone into the carer strategy. So I wanted to just ask, how do you feel as a team collectively in adult social care about what might come out of the inspection? Thank you.
Thank you.
Thank you, Nadia. And I will just say, obviously, we've got brand new staff in post, so it may be that at this point they still need a bit more work to work all that out. So I will give them an out there, but thank you.
Yeah, I think that's right. Just to answer your first question, CQC ask us for all sorts of information around partners that we work with, among other things. And so we tell them, amongst that is the Carers Network. But CQC decide who they want to speak to ultimately. So experience in other boroughs has been that it's been quite wide. But it very much depends on the individual inspectors and where they want to focus. So, you know, obviously the Care Act is very broad, that we have a number of duties under the Care Act, so they can choose to focus in on any particular area of that around the assessment framework. So the short answer is it's up to CQC and they will decide if they want to speak to you or not. In terms of where we are, I think as Councillor Sanderson said, it's still very new for people. It's still very new for CQC. And I think, as I said, it's a learning process for all of us, I think. So we will learn through the process. CQC will learn, they change each inspection as they go, they tweak them a bit and learn a little bit. And I think it's in that spirit that we're approaching it. It's a learning process for all of us.
I was going to make the comment also about learning process. You know, we don't welcome inspection in one way, but actually there is always some useful insight. There are always useful insights and direction, and that's the approach we'll take. I don't want to do their work for them, and I don't want to anticipate what they'll find. As you know, we don't have a solid body of experienced authorities to benchmark, but even with Ofsted, I wouldn't hazard a guess. What I just wanted to check, Nadia, is do you feel you need some more prep from us? I just wanted to check whether, because we can assist with that if we haven't been given the messages.
Well, strangely enough, because we've gone through the process with Borough, and they really wanted quite an intervention from our staff. So I would say no, thank you. I think the experience has been quite. In fact, as far as I know, our borough hasn't actually contacted Carers Network, but I know that we got I think the request for information and intervention came from Borough themselves rather than from CQC, and I know that we were. Not to sort of boast in any way, but we were quite helpful. I think the detail that they required, we were able to provide in a very timely manner. And I think that was of great assistance to CQC. I'm very hopeful that obviously if the need arises, we could do exactly the same here because, you know, we value our partnership with Hammersmith and Fulham tremendously. And it's a very, in all honesty, you know, as a charity, we lead very precarious lives, you know, and retendering processes come every 3 or 4 years. And I think we have reached that stage. But no, I think the staff are very much expecting to be asked to participate and to be interviewed. And I think there's obviously the experience that they've already gained throughout the summer, because they, for some reason, Borough started much earlier. They've already completed, I think, the findings there. So I think that's been a very, very useful. So no, thank you. I think we all, you know, we're very much looking forward to helping should the need arise. And certainly I can tell you from our point of view, I mean, we're very, very happy to do that. We're very happy from the way the partnership has gone, the relationship has gone. So I don't think, if we're ready, we're poised and ready, really is the answer. Thank you.
Thank you very much. Sue.
Right. I just wondered, as part of the self-assessment, were there any particular areas that you thought we need to shore that up a bit, or work that you need further work done in a particular area? And is that in hand, underway? Anything that anyone else can do to support it?
Yeah, I think just picking up Jackie's point, I think it was about the learning and the learning loop and embedding the learning, because an awful lot of work had already been done, developing relationships with partners, making sure that we learn from what people are telling us and we change the way we do things from what people tell us. So I think my observation would be most of that is around actually making sure that we have that learning loop in place and that staff are able to learn from what they hear. So we've got a fantastic co-production strategy. We've done some brilliant work we've done previously around co-production, and it's just making sure that that feeds right through to the front line so that people who are delivering the service, you know, on a day-to-day basis have got that and have got that at the forefront of what they're doing, and making sure that people have the tools to enable them to do that. So again, frontline staff have the tools to do that. So I think that's where our focus has been, essentially making sure we've kind of got that right through, that golden thread right through everything that we're doing. And it is there, but it needs, as you say, shoring up, reinforcing. And I think all of our partnerships contribute to that, because I keep saying this, but it is a constant learning journey for all of us. So I think making sure that we've got those right connections and that we are continuing to build on that really positive co-production work and those positive relationships, as was referenced earlier, is the key to making sure that we've got everything in place that we need to have in place. I'm not sure if that answers your question.
Yeah, yes, it does. I mean, I think it's quite interesting. The council used to have an internal quality assurance team that kind of went through a lot of those sort of internal processes. I know they did kind of department by department. So I think one of the challenges you face is you've had such a churn of staff really over the last 5 years that, you know, my worry is some of that learning gets lost or forgotten or not passed down. So it's, you know, it's the same applies to all of us, is how we keep track of all that, and also how you keep external partners kind of updated with any changes that might have been introduced in terms of systems and processes, because certainly voluntary sector organisations, you know, constantly trying to support residents to navigate the health and care field, which can be a bit daunting at times. And when there's been changes to that, it's really important to try and sort of get that information out as well. So.
Yeah, I think that's absolutely right. And I think you're right, where there's turnover of staff, you have to work harder, don't you, to make sure that everything sticks and that it is sustainable. We do still have a quality assurance team in adult social care, that hasn't gone away. And we've been focusing very much on that quality assurance as part of that learning, making sure that we do understand what people are telling us and that we're changing what we do in response to that. So yeah, completely agree with what you're saying.
Thank you very much. I think the final thing I'll just say on this is, obviously I'm covering Councillor Kwan for the next few months, and so as part of that I've been reading through the CQC reports, and it reminds me a lot of the new SEND inspection where it's so new, there is quite a lot of volatility in the regime. And reading through the different reports in different boroughs, even though they've got different gradings, actually the write-ups are not that dissimilar. So I think we wish you all the luck in the world with the upcoming inspection. There is obviously some brilliant work happening in Hammersmith and Fulham, but very conscious of the fact that this is a new regime coming in. So thank you. Right, can I welcome Councillor Rowbottom, who is the Children Education PAC Chair. We are on item 7, the Better Care Fund Plan 2024-2025 and Q1 report. So Julius, over to you, and could you give your also very long title as well when you start? Thank you.
Yeah, my name is Julius Olu. I'm the Assistant Director for Independent Living Commissioning and Partnerships in People's Services. My paper here sets out the London Borough of Hammersmith and Fulham and the Integrated Care Board as well. The plan, the Better Care Fund plan for 24-25, but also sets out the BCF Q1 report as well. Both of these papers are here for ratification, just purely because the NHS England expects the London Borough of Hammersmith and Fulham to actually submit both those documents ahead of the Health and Wellbeing Board, and therefore it comes here to be ratified afterwards. I'll just say a little bit about the Better Care Fund in itself. The fund is there to support and enable the local authority and the ICB to help residents to be discharged from hospital safely and rapidly, but at the same time to support services in the community to avoid readmission to hospital as well. The actual plan itself was signed off by Chair's action in June this year, whilst the Q1 report was signed off just at the end of August. So as I said, it's just here to be ratified. The appendices has a lot more detail about the actual schemes which are funded by the BCF as well. I mean, one key point or set of points I'll also mention is just what the responsibility of the Health and Wellbeing Board is in terms of the expectation from NHS England. There are 4 in particular. One is to actually ensure or make sure that the plan is jointly agreed between the ICB and the local authority. And that's evidenced already in the plan, which is the appendix. The second one is making sure that the schemes enable people to live well, safely and independently at home for as long as possible. We've got a range of schemes within the plan which actually focus on just those elements. So reablement is an example of that. We've got a extra care, almost an extra care scheme, a number of beds focused on sort of a step down from hospital, and the service wraps around the residents to ensure that they're not being readmitted to hospital. So those are just some examples of services, but there's a range, a whole long list of schemes within the plan, which you'll see there. And then the third condition there is making sure that we're providing services for residents in the right place at the right time. And again, sounding repetitive, but the reablement service, Minturn, the extra care service, all of those are designed to make sure that assessments are happening in the right place, not necessarily in the hospital, to enable people to thrive in the community. And the final condition, which the Health and Wellbeing Board is expected to ensure we live up to, is maintaining the NHS contribution towards adult social care. And I've got my finance colleague here, but I could just say that funding is maintained. The largest part of the funding indeed is the minimum NHS contribution. So I'll pause there. Papers for ratification. Is there any questions? Happy to take them.
Thank you. Are there any questions on this item? Nadia, was that a hand? Oh, that's fine. Enthusiastic eyebrow scratch. Councillor Rowbottom.
Thank you very much. This might be a touch granular, but I wondered if we had staff from social care side attending ward or board rounds at our hospital sites.
As far as I'm, okay, so Catherine, brilliant.
I was just going to say yes, we do. Sorry, Julius.
I think I can't remember whether it was a Health and Wellbeing Board or whether it was a kind of policy overview board, but there was a significant discrepancy last year in the detox and hospital discharge numbers between our side and the hospital. So I was just interested if we could at some stage have some figures on that, or how that group's working together.
Yeah, absolutely happy to bring something back here. There are sometimes discrepancies because there's disagreements around how things should be counted sometimes, and what counts as a delay and what doesn't count as a delay. But I don't know the detail from last year. I haven't seen that, but very happy to bring an update to you here, to the board.
Thank you. Sue?
Just to add to that, so we have regular meetings, so health and social care, we have escalation meetings with Imperial, which is obviously one of our largest organisations, that adult social care attend and health attend. So if there are then any escalations, we pick those up and deal with them as required. So we escalate either to me or to Catherine on both sides, but we can bring some data back. There was a new methodology in terms of counting last year, and I think they are looking at that, and it is getting more refined as we go through. But I think, yeah, if Catherine and I have that conversation, we can probably bring something back or share it with you outside of the meeting.
Thank you very much. Councillor Perez?
Thank you, Chair. From the reporting of Q1 that has been submitted, are there any particular areas of concern at this stage, or areas that we need to work on towards the next reporting period?
Thank you. Not really, actually. I think the NHS England for Q1 required us to report on the discharge funding alone. And in fact, there's a highlight in relation to that, in that some of the discharge funding has been used to fund what's called bridging services. And the bridging services are indeed those services which support people as they come out of hospital to ensure they don't get readmitted very quickly. And some of the work around that is being, or will be, the standardization of that. So our lead, my counterpart, AD, in operations, will be working with neighbouring boroughs to try and bring about some standardization across this part of northwest London. So not really, if I'm honest, yeah.
Thank you. Any other questions on this item or comments? Councillor Boston?
I had another question around mental health crisis care, because I'm not fully up to speed, but I know that the police were sort of in liaison about whether they had capacity to do section 136 anymore. And I wondered about how that pathway worked in our borough, and if we'd seen what the changes is that we've seen?
So I don't know the detail here, but what I am aware of is that the impact has been felt mostly by the NHS. We haven't experienced it very much here in adult social care. So the police are still sectioning people under a 136. The issue for the police was turning up to support an approved mental health professional when they were sectioning someone, so they would routinely turn up for those, or if they were turning up for a welfare visit. So if somebody was behaving oddly in some way and was reported, if they weren't now, if they're not presenting a risk to themselves, immediate risk to themselves or an immediate risk to somebody else, they don't do that. But the feedback I've had most recently is that hasn't had a massive impact, and there are people still being sectioned on a 136. Whether that's right or wrong, that's still happening. I think there needs to be a little bit more work, I think, to understand the broader impact, but the initial response has been not hugely felt.
Thank you.
Councillor Perez and then Sue.
Thank you. In relation to this point that has been asked, just we have we discussed this at some stage in the Health and Adult Social Care Policy Accountability Committee, and I think it would be good to get to look at this situation at the PAC. We've got, I think, a meeting in November in a couple of months, and maybe we can get an update in terms of what's been happening since the changes were implemented.
Catherine, I was just going to suggest, yeah, we can do that and bring some data, which is probably what would be more useful than anecdote.
Thank you. Sue and then Sue.
I just wondered over the last couple of years, is there any data on whether we've planned enough capacity in the right areas? Have we had to shift amounts between different surveys? I know it's impossible to predict what might come up, but has there been any areas where there was more pressure than others?
I think locally it's very difficult for me to say because I've not been here long enough to know that, but Sue might have a view about that from an NHS perspective. But I think we know that there are high rates of readmission to mental health units in this borough, and we're higher here than the rest of central northwest London, and we're not quite sure why that is. And across the NHS and adult social care, we're trying to work to understand that better and look at what we need to put in place to prevent that happening. So the short answer to your question is I don't know, because I don't know enough of the history to know that, but it's certainly an area that we're looking at. Do you mean across adult social care and the NHS, or?
Could infer, we need additional capacity here. If there's, can it be shifted from one to the other? Is it reasonably flexible in that way, or is it fixed?
Shall I come in on that? So there's a range of areas, and Prakash will be chomping at the bit to come in. There's a range of areas that actually are quite contractually fixed in the sense that they're sort of allocated to areas. So then to move those around, what we would be doing is negotiating that as part of our sort of annual process. So when we do a BCF review or when we sort of look at the plan going forward, those are allocated. So it's more tricky to move those in year or in the plan. And we've been having 2-year plans. So this is year 2 of a 2-year plan. What we can do from BCF perspective is when we are advised on the guidance and what needs to be included, we can then have those conversations between health and social care about where we would apply that money to get best effect. So it's not often in year we can do things like that. Northwest London are looking at a BCF review in its entirety, which Julius is part of, and obviously from a health perspective we're part of as well. But we are bound by the guidance. It is quite sort of structured in terms of that. My other point, which was sort of before that one, was in relation to the section 136. I guess there's nothing really specific in the BCF around section 136. It's more a sort of a point around, we know that there are quite a lot of mental health readmissions, and what we do need to do is probably have that conversation at PAC around the impact of that, because it's not specific in terms of the discharge money covers all age, all discharges, rather than specifically around that. So I think we've got to be clear what the BCF does and doesn't do.
Thank you. I'm conscious that pack is quite soon after the date of CQC, so let's just be mindful about content there so that people are around and have capacity to do it. Lovely. All right. Are the sorry. Oh, yeah, sure, Prakash.
I don't know if I put a little bit of context on the finances just to put my 2 pennies worth as well. So for 24-25, what this document's about, both the ICB and the LA have put some more extra funding into the overall programme. So therefore that goes to a range of schemes that Sue's alluded to, kind of thing around that. We paid about 8% increase because of inflation, about 2-3%. So both parties have added 8% collectively into the plan. So £45.6 million is the total PCF budget. It was 41.9 the year before. So that gives a bit of context that we are understanding the issues and problems around it, coming around that. Part of the money of the increase away from inflationary pressures has been discharge funding. And that comes directly from the government, either directly to the local authority or to the ICB. And we've worked up a programme across North West London on that. And that has seen a significant uplift within that 8% increase there. And obviously you asked the question about where the pressures are. That's one of the obvious pressures.
Thank you very much. Thank you. That's helpful. Lovely. So the recommendations are that the Health Wellbeing Board ratifies the planned total expenditure and the proposed schemes in the plan for 24-25. That the Health and Wellbeing Board ratifies the BCF Q1 report for 24-25, and that the Health and Wellbeing Board receive an end-of-year report outlining the outcomes of each scheme and the difference it's made for residents of Hammersmith and Fulham. Are those recommendations approved? Good, just as enthusiastic as last time. Lovely. Thanks, everyone. Great. Okay. ICB update. And this is verbal, so Sue, over to you.
Hi there. So, firstly, apologies because I was a little bit late. It's the Hammersmith and City line. I was running down King Street. So my update is around the ICB.
Sue, sorry, do you just want to say who you are and where you're from?
Yes, thank you. Sorry. So my name's Sue Rooston. I'm the Borough Director for Hammersmith and Fulham, and I am the lead for the ICB. I've been asked to come and present.
Sorry to jump in again. Do you want to say what the ICB is for people who may be unaware?
Sorry, so it's the Integrated Care Board for those, and I'm sure most people will be aware of that. We haven't changed for 2 years, but we are changing. We are obviously always changing. So the Integrated Care Board. So one of the things that I wanted to share is, and obviously the slides, they were circulated late, so we will circulate these round. But just to really bring to the fore who we are and now what we do, because we have just been through a year-long reorganisation where the borough teams particularly have seen a sort of a 30% reduction in our funding, so therefore 30% reduction in our staffing. So, and we've heard it already this evening from Catherine sort of saying there's been a lot of shift and change, and Jackie, a lot of shift and change within the local authority. That is also mirrored in the ICB in terms of how we work and what we are now looking like. So just in terms of what we do, we've got an annual budget of about 6 million, and we provide all of the healthcare, commission all of the healthcare across North West London, and that is to 2.1 million residents. So obviously Hammersmith and Fulham are a key component, and that's where my interest lies. But obviously we've got another 7 boroughs that also share that pot of money. We work with people who live and work in North West London to plan and improve health and care services. So really keen to hear that now that we've got the approved health and wellbeing strategy, and how we can sort of work with obviously our strategic pieces around the ICS for that. The next slide, obviously the biggest bit around there is around tackling health inequalities. So that's one of our key aims, and a lot of the work that we do both across the ICB, but also with the Health and Care Partnership and with teams within the borough, is to improve that. So we've been doing a lot of work around building trust and the health inequalities work that we've been doing. The joint forward plan sets out, so this is agreed across the health system. So it includes agreement from local authorities and work with local authorities. This is refreshed on an annual basis. So we are just about to embark. We've only just feel as though we've got the 9 priorities. We're about to embark on a refresh. which will obviously take us sort of further and deeper into sort of where our priorities. So the priorities may not shift and change very much over the coming year, but they'll be refined. And again, similarly to how Nikki was saying, if there's emerging themes or emerging priorities, then things will shift and move. Our next slide is the new organisational structure. So we've got a range of programme teams. We've got our place-based partnerships, of which the borough team will input and support into. And then we've got ICB corporate teams. So they're very much our sort of functions around medicines management, finance, and the corporate HR type functions. But I guess the key things for us are around the place-based partnerships and the local delivery of the strategic and health and care services. So that really is fundamental in our relationships locally with the local authority and obviously the health and care partnership teams. So you'll see that there's a range of programmes. There's strategy, governance, finance, estates, and then we've got quality and clinical services, and then our comms, HR, digital and data. So you'll see those on there as well. I think the key thing, we are also sort of looking at what are our values. So we've narrowed them down. There was quite a big long list of values which we thought were quite cumbersome and therefore quite difficult to work to. So we have now refined them down to 4. So inclusive, respectful, innovative and empowering. And the organisational changes got implemented on the 2nd of September. So this is very much work in progress and an ongoing piece that we will obviously develop and refine as we go through. I guess the key bit is the sort of final slide, which is the organisational structure for the borough. And one of the things that we wanted to come and share today was to sort of show who the people are that now Health and Wellbeing Board members and obviously our colleagues in the local authority can approach and speak to in relation to sort of all things health related. I know that Caroline Farrer, who's the MD for the partnership, is also doing a piece of work around collating all the different structures across the various organisations so that actually we can then have a bit of a who's who across the piece. So you'll see that obviously I'm in the role as the borough director. Previously, so we've lost 6 people, 6 posts from our structure as part of the reorganisation. So we are really having to shift and do things differently as well as stop doing some things. So you've got myself as the borough director. I've got an AD, Rashesh, who has recently moved from Ealing and is coming to work with us in Hammersmith and Fulham. We've got some programme delivery managers that have sort of lead roles in a number of areas. And then we've got some support delivery managers as well. So you will note that obviously there are, as I say, six people less. So we're a little bit lighter. We should be saying leaner, but obviously there will be, one of the things around that is that there will be some corporate memory that's also sort of disappeared as part of this transition. So we are very much sort of in the same space as some members of the local authority, learning in new roles, learning sort of new partnerships and new sort of relationships. So just bear with us if you can, that would be really helpful. We've still got our lead clinicians. Unfortunately, Dr. Kavanagh can't be here tonight, but we've got both Dr. James Kavanagh and Dr. Claire Jarman, who are both GPs. Claire is not a GP locally, but she brings some independence in terms of sort of GP input and clinical input. And James, who a number of people on the board will be aware is a local GP and has been in various roles. So over the time. So we still have quite a bit of stability, but also some change. So please bear with us while we settle down. I'm happy to take any questions, but it was really here just to sort of say that actually this has been a long and quite sort of exhausting process for everybody, because there's been a lot of people that have either been made redundant or retired or sort of moved on because of the process. So it has been, it's been sort of, quite a difficult time for people within the NHS at the moment. Thank you.
Thank you, Sue, and we wish all those people the best. Any questions on the update? Jackie, go to Jackie and then Councillor Robotham.
First of all, Sue, thank you very much. And it's good to see you here. I know it has been a very arduous and quite grueling process for you and your colleagues. So welcome, Sue's got a long established relationship with us. One of the things I did want to say was that in recognition of the need for us to work closer with health and, you know, in times of continuing constraints in terms of capacity and resources, we also have done a restructure to create a post which Sarah is currently in, and that's her long title of Commissioning Transformation and Partnerships, but it's very, we have created it very specifically so that actually we have more capacity to be engaging with health. We're very keen to work together and to respond to the needs that some of our members here today have raised, and to be in a position to be even more responsive and flexible. We do regret those colleagues who have left, and I'd like to also convey my great thanks to them and the work that they have done over the last few years. But both on the children's and adult side, Sue and Caroline, who's not here, I do want to really reiterate our commitment to working in partnership with you. So thank you.
Thank you very much. Councillor Robotham.
Thank you. I wondered if we could go back to the priorities slide, if possible. Sorry, I'm not sure. I think I'm speaking through here. I'm not just doing this as a ruse because the camera angle tonight, David, is one of the most unflattering I've ever seen. But I can get it started. But I wondered on the first one on targeting inequity, how are things being delivered differently? Please talk about data, AI, follow-up, Cerner, anything anything you like. But I'd be very interested to hear how things are being delivered differently for that priority. And secondly, if you could talk more on my pet subject on priority 2 on children and young people's mental health and community care. Thank you.
So there's a range of projects and work that we're doing both together and obviously individually. So this is probably the one that is the most sort of all-encompassing for the ICB and for obviously our colleagues in the council. So I guess there's a range of things. I think Nikki's already alluded that we had some health inequalities funding, that we've done some seed funding, and we've funded some short-term projects with some non-recurrent funding. There is also the Big Building Trust programme, which we are contributing towards and are working with people as a key partner, which again is about raising awareness, building that trust, and therefore, you know, the output from that will be to reduce inequalities and bring people so that there is equality of access to services for people that don't, you know, that haven't in the past. So there's a whole range of things. This is probably the sort of like the mainstay. We're looking at our integrated neighbourhood teams as part of our working with primary care and sort of other partners, our work with sort of prevention and our sort of, you know, public health services as well. So they're all linked into that. We can probably bring or share with you, we've got a sort of an inequalities work stream, which actually Linda Jackson was leading. So we're looking at getting a revised SRO for that. But we've got some sort of the pieces of work that we've funded. We can probably share some information around that if that's helpful, Helen.
It would be. I just would be, maybe on details, but I don't think anyone would disagree with any of these priorities, but what would be useful to see is how things are being delivered differently to target different groups who you haven't reached before.
So we're doing that based on priority need. So obviously we're looking at the core 20+5 piece of work that the NHS England has established. So there's ongoing pieces of work that are happening through that. I think, again, this is probably one area where we can sort of bring something back that talks specifically around all the work, because it's not just in Hammersmith and Fulham. This is work that's happening across North West London. We've got a population health management team sort of working across across the piece. So, but I don't know if there's anything from a council perspective that you're doing particularly that you wanted to talk to.
I was just going to say the same thing, actually, Sue. So, for example, on priority 2, there's an extensive piece of work that North West London Mental Health Board are leading to look into and research around crisis intervention for young people with mental health. So there's been a number of workshops that have been put together. We're looking at a blueprint for changing the protocols around hospital admissions and discharge and the community response around mental health. So it's very much in that kind of research phase. And we are very much working together on that. So we've, across the region.
Thank you, Jackie.
Chair, just picking up the question and also the response, I'm wondering whether it would be useful to have an update on all these. I think that you know, so that we could pull something together for the next Health and Wellbeing Board, but also, Sue, because you're in the process, I know, of beginning to review the priorities. So it might be helpful to have a sort of position statement on where we've got to. Obviously, because there are 9 priorities and very detailed, and I think we'd be looking for a summary on those, but also where are the gaps that you would inform the future development, the development of future priorities.
Thank you. I think that would be welcomed. I think probably priority number 7 is one that we'd also like to focus on, given the interest of this committee. Thank you. Great. Any other questions on this? Councillor Perez.
Thank you very much. I also wanted to echo Jackie, and thank you very much, Sue. I know we've worked in the past with the Policy Accountability Committee, and there's been a lot of collaboration. So I wanted to thank you and also the staff for that collaboration. I've got a question in relation to workforce. I know in the past there have been some issues about recruitment and retention. Is this an area of concern for you at the moment? And just wondering if it carries on to being, I think it was noted as an area of that it was an issue in the past.
In particular relating to the ICB or generally? Because I think, so generally, I think, the workforce is, for NHS workforce is still a sort of an area of concern. And obviously from a clinical perspective, I think, you know, that is more so from an ICB perspective. We've sort of fixed our position at the moment, and we're carrying a number of vacancies across the organisation. So the important thing now would be to try and fill those appropriately. Fortunately, in our structure within Hammersmith and Fulham, we don't have any vacancies. So actually we're working at a, you know, we're okay at the moment. So I've just got to get everything crossed that actually we keep our now new team happy and we retain the skills that we've got.
Thank you very much. Any other comments, questions on this item? Fine, thank you. Okay, number 9, work programme. Do members have any suggestions for the work programme? Sounds like there's various items that have come up this evening. I personally, following what sounds like great work today at the vaccine confidence building workshop, would love to have a bit of an update about vaccines and how they're going, because it sounds like things are not going in the right direction. So would love to see a bit more. I know Ealing had a bus that they were driving around, not saying we should do that, but always open to new ideas. Any other thoughts on work programme? Great, Nadia and then Sue.
Thank you. Well, I must admit, very concerned a few months ago when we looked at the report into suicides, and I would like to link it. We have, I'm sorry, I'm pointing to my colleagues at Health Watch. We have an event taking place on the 28th of September, but I'm actually concerned really in terms of our work going forward. As a local resident, to hear that our borough, which as large as it is, you know, is very concerning that we have such a high, if not the highest, rate of suicides. And I wanted to suggest that we look into the reasons as to why that may be. I mean, I know we've got obviously a lot of tube stations, a lot of bridges, you know, a lot of, I'm just trying to understand, and I posed the question, and I think whoever was responding at the time, I can't remember quite who was the representative of whichever agency that responded to my question, but I was just simply trying to understand why. And I sense that reluctance, but I think it's really crucial that we look, and I do want to sort of highlight the work that Health Watch does in that regard. I'm hoping that many of you may be interested to attend our event, but primarily in terms of our work going forward, could we look into the reasons? Why is it that our borough, which I know tremendous amount of prevention work is going on, and yet, you know, we have incidents like that. I wanted to understand what the root causes are and indeed what we can do collectively, not just as a board, but also as you know, as I don't know whether representative of the local authority is correct to describe ourselves as, but as a partner of the local authority to understand what it is that we can do to really see a reduction in that rate, which I believe, if I'm not wrong, is the highest in London of all the boroughs. You know, what is it specifically about our borough? And I also wanted to understand why that reluctance. I mean, I wasn't at the time asking for any particular details, because I know we looked at some case studies at the time. It was purely sort of in general terms, what it is that our residents experience or struggle with to actually take that drastic step. I know mental health provision is well, that's challenge in every borough. Let's be honest. That's in fact challenge nationally. But yeah, I would suggest that we look into that in greater detail if that's something colleagues would think it's sensible.
Thank you, Nadia. And I know an item on this did come through earlier in the year, and I think there's been a further item from the BI department on suicide. Jackie.
Thank you. Thank you, Nadia. It is a huge concern to us. And only on Monday, the leader of the council launched another event at Fuller's Pub, which Nikki and her team had set up and developed, trying to reach particular cohorts of the vulnerability, which were articulated in the March meeting. I suppose I have some concern that there is any sense or any perception of reluctance. That's absolutely not the experience that I've had in this role, and indeed as Director of Children's Services. It's something that Nikki has continually highlighted and escalated, and the leader of the council, Councillor Khan, has taken very seriously himself and very much led in that. One of the initiatives, and Nikki can say a little bit more, is that Nikki is in the process of getting a commissioned review. We just need it ratified by a board, so it will take some time, but it absolutely mirrors your concerns. We absolutely share them. There is no reluctance, certainly on the part of public health or on the council in general. It won't be ready to report by the next board, but we will look at sharing the findings once we have properly taken it through the governance to commission and set it in motion. I don't know if you want to say anything more.
Yeah, thanks, Jackie. We do take it very seriously. It's one of our priority areas. We do have a high rate. Unfortunately, other boroughs are hot on our heels. I'm very sad to say that. We're in a post-COVID world, lots of uncertainty. We are an inner city borough. Issues like unemployment, crime, severe and enduring mental illness, and drug and alcohol use are a feature of our suicides. We have higher than in other boroughs proportion of our suicides in patients under the care of mental health services. So we are, as Jackie McShannon has said, we're doing everything. Where we see a risk factor, we immediately act on it. And we've been working in close partnership with the Listening Place to disseminate that kind of training to all organizations. We also work very closely with your colleague, Carleen. We know about the event, and Carleen was at the Fuller's Brewery on Monday. We work in partnership with absolutely everyone. If Health Watch would like the Listening Place training, we're bringing more VCS partners on board, like James's Place, Andy's Man Club, and also Men Who Talk. And you mentioned the bridge, Nadia. I've been on the bridge. I've done the suicide training myself, and all of our Conway's bridge staff and Highways colleagues are fully trained in suicide prevention. So we are trying everything that we can. If there's anything that you think we should be doing in addition, please let us know. But yeah, we feel deeply sad about our residents, and every suicide is poured over in minute detail. But thank you so much.
Thank you for raising it. Obviously, it's a complicated topic and there's very rarely one route to suicide. So thank you. Given that it came through in March, I wonder if it should be reviewed at some point next year. So that could be added to the work stream for later on. Thank you. Any other, Sue?
Yeah, mine's actually linked to that one. I'm interested in looking at community mental health services, not necessarily in hospital services, but what we're getting feedback from is so many people experiencing low mood, depression, anxiety, and it's having an impact on every area of their lives. And we know that, CAMHS is so overwhelmed that they can't keep up with the demand. And I think adult mental health services and community-based services are the same. And it's kind of, I'm just interested in looking at if they're not treated soon enough in the community, where that ends up going. And the worst case scenario obviously is suicide, but I'd be interested in exploring that in a bit, what the capacity is, what support's available, how, are there any particular communities that are more adversely affected than others, or who aren't accessing community-based services as much as we would hope they would. I'd be interested in that if that's possible.
Thank you very much. Any other suggestions, Nadia?
Thank you. Something else occurred to me, and I hope colleagues won't mind that I mention this, but I think we're very fortunate that we actually have a DI CAN with us. And we used to have obviously a previous colleague whose name I'm sorry I can't remember, but he was always attending meetings regularly. And I think we do live in very challenging times, and I wondered whether we would have our agendas would allow some space for you to talk about the challenges that you face in terms of policing the local area. I mean, there's incidents of, antisocial behaviour. When the clock goes back again, I know because I sit on the children and education pack as well, and I know that there's incidents of mugging that are on the increase when obviously, kids are coming back from school when it's dark and things like that. And I wondered whether, because I personally would find it very helpful to hear from you and to see what really areas that you were focusing on. I know we were very concerned, and I think we looked at that with Health Watch as well, when obviously the police decided not to sort of intervene, to put it very crudely, in certain situations where in the past you might have been challenged or requested to deal with, dementia sufferers going sort of walkabout and things like that. So there's been a lot of changes that are, I think, of concern to the public. So I wondered whether colleagues would think, and whether your capacity would allow for you to share some of your experiences with us.
Thank you, Nadia. What I will say is you'll be delighted to know that there is the Community Safety Board, which is set up exactly for that reason. So that's where that's all heard. So thank you.
Sorry,
No, that's fine. There are a multitude of boards, but yes, that's very much where it comes. Thank you. Right. Any others? Fine. Thank you very much. Oh, sorry. Hello.
Hello, everyone. I'm Chloe, the Engagement and Project Officer at Health Watch, also joined my colleague. We're just stepping in place of Carleen Duffy, who had apologies this evening, who just wanted to relay 4 suggested future items for the agenda, if there would be capacity to have regular short updates from Health Watch. We're aware that Health Watchers in other boroughs have a regular item in their Health and Wellbeing board, so we just thought we'd put this to the board. Thank you.
Yeah, seems fun. I mean, I'm only interim chair, but I could integrate on an interim basis. Lovely. Thank you. Turn myself off again. Lovely. All right. Well, I think that brings us to the end of tonight's meeting, which must be the shortest Health and Wellbeing Board ever. So I'm going to confirm future dates of meetings, which are 11th of December and then 19th of March. Just make sure those are all noted. Thank you very much for coming. Lovely to see everyone. Have a good evening.